So our second lecture, we talk about antiseptics and disinfectants. Of course, all surgery cannot work without some rules, and rules of sterilization for us is the most important. Antiseptics and disinfectants. So introduction, all of this substance, it's antimicrobial. Antimicrobial is the substances derived from a natural or synthetic sources that kills or inhibits the growth of microorganisms such as the bacteria, fungi, and protozoas. Germicides, it's another group of drugs that are able to inhibit the growth, development, or leads to death of microorganism in the environment surrounding the patient or on the surface of the body. Especially agents which inhibits or kills microbes on contact, they have a lower margin of safety, non-systemic use, of course. Germicide divides into two, antiseptics and disinfectants. Antiseptics, by the name, yes, anti, it's against, species, it's emitting of a fetid smell. Chemical substances which are used to destroy, inhibit pathogenic bacteria, not the spores on animatic or living surface such as the skin, eye, mucous membranes, as in the mouthwashes. In 1979, Lister opened and written antiseptic surgery. So Lister, nowadays, he's the father of antiseptic surgery. They falls under Drug Control Agency of the government. Disinfectants, it's a chemical substances or germicides which are used to destroy or inhibit the growth of pathogenic vegetative bacteria, not the spores in inanimate. So it's a non-living surface such as glassware or surgical instrument. For example, formaldehyde, phenol, ethanol alcohols, and another types of soaps. They falls under control of Environmental Protection Agency of the government. They process concentration depending killing. Antiseptic and disinfectants are often added to easily available everyday utilities like soaps, toothpaste, mouthwash, after saving lotion. Some ancillary terms. Sterilization. It's a freeing an article, a surface, or a medium by removing or killing all microorganisms, including vegetative bacteria, spores, fungi, and viruses. Usually sterilization affected in autoclave. Pressure, it's approximately 15 of a stream at the 120 degree by Celsius for at least 30 minutes. Other methods include infrared radiation, ultraviolet radiation, and gamma radiation. Decontamination, it's a marked destruction of viable pathogenic organism to a level that will allow a healthy person's natural defenses to prevent any infection. Sanitization, it's a reduction in microbial load from an inanimate surface to a level set forth by Public Health Department of Environmental Agency. Pasteurization, process of heating milk or other liquids or semi-solids for about 30 minutes at 60 till 80 degrees by Celsius, which kills the non-saprotic microorganism and prevents the growth of foodborne pathogens for a specific period of time. Deal antiseptics and disinfectants. High efficacy, it's a broad spectrum, rapid onset, tidal, not static, active in presence of blood, pus, exudates, and etc. Non-toxic, non-irritating to tissues, should not delay healing, non-absorbable, and chemically stable. Deal antiseptic, it's an added advantage like non-staining with agreeable color and odor, could be added to soaps, and non-corrosive. Mechanism of action, it's an oxidation of bacterial protoplasm by using galogens, denaturation of bacterial proteins, enzymes, it's phenols, chlorhexidine, alcohol, aldehyde, detergent-like action increasing permeability of bacteria membrane. So what is the factors which modifying action? Of course, it's temperature and pH, period of contact with microbes, nature of microbes involved, size of inoculum, presence of blood, pus, or organic matter. General use of germicides, it's asepsis before injections, surgical use asepsis before surgery, scrubbing, sterilization of the surgical instruments. Also, we can clean cuts, wounds, and laceration, and water purification and domestic disinfection. Classification, pharmagot, yes, by name, it's P phenol derivatives, H galogens, A alcohols, another A it's aldehydes, S it's surface active agents, quaternary ammonium or cationic, and soaps of sodium and potassium. Metallic salts, another it's a silver, zinc, and calamine. Acids like boric, acetic, gases ethylene, oxidizing agents, dyes, and miscellaneous. Phenol, it's derivatives most common, one of the earliest used antiseptics, and still the standard for comparing other germicides, weak against static at 0.2%, in bacterial at more than 1%. Poor action bacterial spore, protoplasmic poison. Uses disinfection of urine, feces, pus, sputum, antipyretic preparation, mouthwash, and some side effects. It can lead to buccal, esophageal, gastric burns, scars, and strictures. Crystol, it's a X3 potent than phenol. Uses disinfecting of utensils, excreta, for washing hands, irrigation of root canals. Chlorhexidine, non-corrosive, non-irritating, to intact skin, no stain. Uses for surgical antiseptics like skin cream, mouthwash, soaps, wounds, and cuts. Hexalic raphen, it's a potent chloranide phenol, substance actions, using also for surgical scrub, toilet products, and deodorant. Side effects, of course, unfortunately, it's a neurotoxicity in neonates, more than 2%. Phenol derivatives, it's a triclosan, used liquid soaps. Thymol, it's antiseptic. Riconsinol, it's a less potent than phenol. And all of this, which contains are menthol, thymol, metic, salicylate, and eucalyptol. Another group, it's oxidizing agents. It's a potassium permanganate, highly water soluble, antiseptic, domestic using, gastric lavage, and styptic. Side effects, of course, it's a burns and blistering, stain, rusting, and sensitive to life. So next lecture we will continue our theme, antiseptics and disinfectants. Thank you for attention.